I used to be able to hike, but over time it became harder and harder. I would get breathless.
And I would have trouble breathing when we went up hills, taking grandson out for a walk.
I think back, that's why I couldn't do this. I couldn't walk on the beach. I couldn't play golf anymore. The fun things that I used to love to do.
When I finally saw a pulmonologist, I found that I had only about 80% of normal breathing capacity for a person my own age.
My lung function was 70%.
I was actually sick about 10 to 15 years before I was diagnosed with this disease.
When the results of the blood test came back, I was diagnosed with Alpha-1.
I have Alpha-1 antitrypsin deficiency.
It was a life changer.
Alpha-1 is a hereditary condition in which the body doesn't make enough of Alpha-1 antitrypsin, an important protein.
Even though it is rare, it is the most common cause of genetic emphysema, and it can lead to COPD.
My brother and my father had passed away due to Alpha-1.
The doctor told me that I had 5 years to live, 10 at the maximum, which was a shock.
I'm currently an active candidate for a double lung transplant.
In my research about Alpha-1, I wanted to know what I needed to do to live with this disease more effectively. I wash my hands frequently. I get 8 hours of sleep a night. I started on augmentation therapy right after I was diagnosed.
Many alphas receive augmentation therapy, and in my case, I have a nurse that comes by every week and gives me the medication.
Hi, Cheryl. Come on in. Hello. Good morning, Gwen. How are you?
I'm just fine.
I go to an infusion center once a week to get my augmentation therapy.
The augmentation therapy does increase the levels of Alpha-1 in my blood.
Because there is no cure for Alpha-1. We can treat it with augmentation therapy, but that's totally dependent on plasma donors giving plasma.
I used to be a regular plasma donor, so I can appreciate the sacrifices that people make to provide that for me now.
Every time I get augmentation therapy, I give a prayer for the donors. Now, I'm often asked, how long do you have to do this therapy? How many times? I say every week for the rest of my life. And so I am indebted to the donors for the rest of my life, which I hope is going to be a long time.
My alpha friends and myself were very thankful for the people that do take time to come donate their plasma. If there were not regular donors of the plasma, we would not be able to receive our augmentation therapy.
This augmentation therapy is approved for Alpha-1 patients by the FDA.
November is Alpha-1 Awareness Month.
It's only been 50 years ago this year that Alpha-1 was even identified.
For 25 years, Grifols has been making augmentation therapy medication for alphas like myself.
Grifols employees are just absolutely vital.
Grifols makes a lot of the leading plasma medicines.
These plasma medicines treat sick patients all over the world. And that is why it's so important that donors continue to come back and donate again and again.
I'm grateful to the makers of the augmentation therapy and to the staff that works at the donation centers, as well as to the people who are donating.
Thank you.
Thank you.
For me.
For me.
For all of us.